Congressional Democrats sent the final piece of landmark health care legislation to President Barack Obama before heading home to face a skeptical and sometimes even threatening electorate. The last legislative chapter in the wrenching national debate over Obama's health overhaul plan has been approved for the second time. A package of fixes to the sweeping health bill the president had signed 2 days earlier. The measure includes better benefits for seniors and low-income and middle-class families. We discussed the political wrangling over the health care overhaul, and we asked the question, can the president sell it to the American people? We asked that on this episode of The Professors.
From across the city and the 7 city colleges of Chicago, broadcasting from 63rd and Halsted at Kennedy King College. Professors take the art of conversation to a higher degree.
Republicans took to the House floor last Thursday to plead with those who oppose the Democratic health overhaul to refrain from violence and threats. Representative Mike Pence of Indiana, the House's third-ranked Republican, said, and I quote, "There is no excuse for bigotry, threats, or acts of vandalism, and I condemn such things in the strongest possible terms," unquote. Joining us today to dissect the healthcare overhaul are Dr. Max Galeas from Truman College and Rafael Rivadeneira, president of the Republican National Hispanic Assembly of Illinois. Welcome, gentlemen.
Thank you. Thank you for having me.
I'm very excited to have this conversation. Everybody in the country is talking about healthcare reform. And let's go ahead and get into this, which I think is going to be a very fun conversation today. How do you guys feel about what happened this week? Rafael?
What happened this week should be intolerable.
Okay.
It is intolerable. The president showed total disregard for the will of the people, showed disregard for the process of the Constitution and the rules of the Senate and the House, and he totally ignored the bipartisan opposition that was behind this bill.
Okay.
Just totally trying to ram through an ideological filled bill.
Okay, well, you tell us what you really think, Rafael. Obviously, you feel very strongly about this. Max, what do you think about this?
Well, health insurance reform is not, I think, what most people voted for a year and a half ago. What they did vote for was a comprehensive health reform across the country, for both the reasons for the individual health of the citizens as well as for the economy. In terms of process, the disappointment might be that the president actually gave away too much too soon, did not come in with came in at the very beginning with a bipartisan approach, which Bill Clinton did as well. And he got burned for it because the most extremist elements of the Republican Party seem to be the ones pushing the agenda. The caricature, the rhetoric, the way that this entire issue was then misrepresented, as well as the reform packages misrepresented to the American public, played on their fears at a time of extreme economic alienation and worry. And it worked beautifully. They were able to delay the reform for a very long time. And as a result of that, we end up getting a system that, yes, the sky is going to be following Republicans. The profit system is going to do very, very well. The profit system,
Absolutely.
which in my estimation is actually causing most of the problems.
Yeah. Well, let's do this. Before we even get into the politics of it, because I think we have a lot to talk about in politics, but let's talk about policy. What has this health care bill accomplished? I mean, obviously we know that it mandates coverage. There are penalties if you do not get health insurance. It extends the age of that children or young people can stay on their parents' insurance from 23 to 26, which actually, I just have to say this publicly, I am so proud because Illinois actually did that first, did it before the nation did, which is rare that we do things like that before the nation does them. We're known for corruption lately, and so it's good that we're known for something good in the nation. But also, what else? What are some of the other components of this plan?
Well, pre-existing conditions is a
Exactly.
major part of the concern that most Americans have. We have a profit system that's in place. Therefore, actually providing coverage, catastrophic coverage, is not profitable. And as a result of that, you do not have the ability to go to your health insurance provider and get the kind of help you or your family needs when you most need it.
And so this bill ends that.
This bill is supposed to at least start the process toward ending that. I'm sure litigation and legislation at the state level will probably delay that for some time.
I think the main issue that's always been the case is the cost of health insurance is just through the roof.
Yeah.
And this bill does absolutely nothing to reduce premiums on health insurance. So while there were a few good components in the bill, I think in the end it did not solve the problem.
Okay.
We're going to pass on those costs now to the government.
All right, Raphael, let me say this, because I know that Republicans today are sort of getting the bad rap for just being the no party, as we say, right? And they haven't come, many people believe, with a lot of solutions on the healthcare issue, especially with cost. But you were just sharing with me earlier what some of the solutions that you thought should have been in the bill. What would you have liked to have seen in the bill?
Okay, first of all, I would dispute with that the party no.
Okay.
I think that's a misrepresentation of the Republican Party. The Republican Party has always stood for tort reform.
Okay.
The Republican Party has always stood for more pooling of small business owners to be able to buy group plans, which will reduce their costs. And the Republican Party, I think, is more about trying to address the issue of affordability.
Okay.
We're also forgetting that as much as we want to blame Republicans, the Democrats have one of the biggest majorities in the Senate, and all they need was one vote of one Republican, and they couldn't do that. I mean, even in the past, George Bush was able to work with many Democrats to get the needed filibuster proof. So I think we're blaming too much the right, and what we're looking at is a president that alienated the people and didn't
but Raphael,
do what they
why
wanted.
didn't then? How come the Republicans did not put forth health care reform under the Bush administration? How come when you saw the people that took all the bullet shots for this, it was Hillary Clinton and Bill Clinton back in the 90s, and basically it's Obama and the crew now. If the Republicans wanted health care reform so much, why have they not put
speak to
forth?
that.
Well, we're also, wait a minute, President Bush was the one that gave prescription drugs, which was against most
Yeah,
of the
but
party.
prescription drugs was a huge expenditure. You talk
It
about
is.
cost. That
Absolutely.
was unbelievable.
It's one of the things that Democrats blame for the deficit,
Yeah.
even though that's
Well,
what they
it
want.
should.
And that was a Democratic-led initiative for reform, was prescription drug costs.
So we're talking about, again,
So
all
that was
these costs
so
are tacking onto the deficit, which we're talking about right
But
now.
tort-
Doesn't matter.
Okay.
The thing
go
you're
ahead.
always going to get a Republican to say is tort reform, tort reform, tort reform. Tort reform is a replacement for, it's payback, is literally what it is. You get these litigation, much of it is debatable, accepted in the court of law, but you have individual patients who do not feel as if the insurance company is actually going to pay for the things that they promised that they were going to pay in the first place. And as a result of that, many, many people are broke as a result of medical costs.
Yeah, and speaking of the insurance companies, I mean, this bill has given them a lot more business. And that's the reality that we have to think
Expanded
about.
immensely.
So
why
we're
the
not
caricature?
destroying the free
But why
market
the
here.
caricature? If that's the case, why the caricature? From the very beginning, Barack Obama came in thinking that he was going to eliminate the possibility for the kind of fight that we've had in the last year. And to his credit, he went to the Republican Party and he created a deal with the insurance companies first to try to get them off his back. And then he tried to create a Republican initiative that would actually include tax incentives and tort reform as well. No other Democratic president was willing to do that, at least as a possibility. And what ended up happening was the blowback occurred. The 25% of the Republican Party, not represented by our good friend here, came in and completely blew off the lid of any kind of rational discussion on this issue. And the very people the population that ends up voting in favor of health care reform ends up then suddenly becoming more and more fearful of the kind of change that was coming. And suddenly then you get these ideas about socialism and this kind of, or even national socialism, right? I mean, and extremism that ended up taking over the entire debate.
Right,
and that has been the discussion for the past 6 months in this country,
Raphael,
not the
you
issue of health care reform.
Okay.
I mean,
Go ahead.
you got to be kidding.
Okay.
I think one of the
Maybe
major
it is
things
part
here,
of that 25%. Maybe that's the part I was kidding about.
He was trying to give you credit there, and he jumped into 25%. So yes, go ahead.
First of all, I think all that was for show.
Okay.
I mean, reaching out to the Republicans and not
Do
offering.
you really, Raphael?
Yes.
Okay, fine. Okay.
Well, he took off the book, the public option, almost. First of all, single payer was not part of the debate. He took that off before he even started discussing anything with health insurance. So that was. Then he goes to the Republicans and he introduces the idea of a public option, and then that's off the table. He's negotiating against himself, and I think the Republicans saw the momentum and they kept
because
going
the
with
American
it.
people are against that. Polls show that the American people do not want the public option.
Yeah, but
Republicans are representing the majority of this country that is against single payer, that is against public option.
They're against the
Wait a
caricature.
second.
They're against
The
mandate.
polls,
They're against the caricature.
But
They're not against the
polls show
actual
that,
reality.
But the American people gave him majorities in the House and the Senate. They allowed him to do that, and they put him in the presidency. So the idea that they're against his agenda and Nancy Pelosi's agenda and Harry Reid's agenda is laughable because they put them in there.